Hi, we're here at the Health 2.0 conference in Las Vegas, Nevada, 2024. And who do we have the honor of speaking with?
My name's Dr. Jeremy Manuele. I'm a board-certified orthodontist, dentofacial orthopedist, and I am happy to be here. Thank you for having me.
Perfect. We're excited to have you here, Dr. Jeremy. So, you are a Health 2.0 Conference USA honoree. How did it feel to receive recognition for your accomplishments?
Well, it was honestly, it was great. I mean, I love it. But at the end of the day, really, the accomplishments are great. But what I really love is spreading the word and making sure that people and patients understand, what's available to them, especially as it relates to their health and their growth and development for their kids. And so although it's a huge honor to be here, I mean, really it's exciting to be able to share what I do with a broader audience and really inform people and let them know how this can make a difference for them and their children.
It's amazing. Thank you for sharing that. So, what advice would you want to give to someone that is wanting to follow your own footsteps?
Oh man, yeah, that's a lot of the feedback I get from people close to me is that I'm very busy, so I tend to take on a lot of different things. So I don't know if you want to follow in my footsteps or not, really, but certainly, I mean, love what you do, right?
Okay.
I mean, that's got to be one of the biggest things. Make time for those things that are important to you, and reevaluate. There's always going to be more opportunities, more things that come your way. At the end of the day, I try to focus my energies on those things that I'm most passionate about and those areas where I feel like I can make the biggest difference. And I think when you combine those two things, your natural abilities, skills, whatever God's blessed you with your passions and what you have interest and desire to make better, to transform, that those two things can be really powerful working together.
That's awesome. I love that. Now, how has your learning and networking experience been so far at the Health 2.0 Conference USA?
I had not really any expectations coming here. I didn't really know what to expect. Surprisingly, very good.
Yeah.
I met the very first person I met. We had so much in common, from military background to some personal challenges that we had both faced in life, and and also medical. Physician versus orthodontist. But yeah, it was really interesting. I was not, my expectations were not crazy high. I wasn't sure what to expect, but it's been a really unique and it's been a lot better than I was thinking it would be. So
We're glad to hear that.
Yes.
Now, where can others reach you for collaboration or advice?
So I am on LinkedIn. Our practice website is hmortho.com. I also do some education for other doctors on innovatorortho.com. But LinkedIn's probably the best way to get me directly.
Okay.
Yeah.
Perfect. Can you explain the concept of adult non-surgical skeletal expansion?
There you go. I like that. It has a good ring to it. Yeah, so skeletal expansion is essentially very simple when you're talking about kids. You've probably heard of an expander. It makes the jaw wider. And when you're growing and you're young, that's very simple to do. You can just put something on the teeth and move it, and then the jaws move. When you're an adult, it's a little bit more difficult. And traditionally, it would require surgery. But now there are non-surgical techniques that allow us to actually expand adult jaws and make them wider. And the benefits of doing that are obviously multifold, sometimes aesthetic, but I would say most of the time health related. Being able to breathe better through your nose or sleep better, things like that. And so it's a newer procedure that emerged, maybe in its infancy about 10 or 15 years ago, but it's becoming more mainstream as more and more doctors learn about it. But it's definitely transformative for those patients who need it or seek it out.
Wow, that's amazing. Oh my goodness. So what are they hoping to achieve with the surgery?
Yeah,
non-surgical.
With the non-surgical, with expansion.
Non-surgical.
So with expansion, people are basically looking for one of a few things. So sometimes it is just aesthetic. They want a broader smile, or maybe they had teeth extracted and they didn't like the way that the arch form was constricted. It's not as wide when they smile. So that's one of the reasons. One of the bigger reasons is breathing and airflow. Basically, the nose and the top jaw are connected. So they share the same bone. So when you expand one, the internal portions of the nose expand as well, and it becomes easier to breathe through your nose. And so that is one of the biggest reasons why people will seek it out, because they're on a CPAP machine or they're not breathing well. And so being able to expand the jaw to open up those nasal passageways so that they can breathe better naturally helps them. In some cases, they are able to get off a CPAP or oral appliances or whatever else. But in other cases, it at least makes their reliance on those things less. And then also in exercise situations like that, they can breathe better.
That's amazing. Wow. Okay, so how long does it typically take for an adult patient to see noticeable results with the MARP?
Yeah, sure.
MARP.
Yeah, MARP. So it stands for Micro Implant Assisted maxillary skeletal expander or maxillary palatal expander.
Okay.
Yeah, so it's basically a normal expander, but there's little temporary mini implants that anchor it to the jaw to allow the expansion to happen in adults and non-growing patients. And so within usually the first month, you're going to notice quite a difference. You'll know when the expansion process happens because you actually get a little bit of a gap between your teeth. Which makes sense because there's two halves to the top jaw. So when they widen, the two teeth follow those two halves and you get a little bit of a gap between your front teeth. But along with that gap, again, you start to notice the changes in your breathing. You'll also notice as that gap gets wider, the smile is getting wider. And then orthodontically, we move the teeth after the jaw's correct in order to, make everything perfect so you don't have a gap in your teeth forever. Yeah.
That's amazing. Wow. Okay. Now, is everyone a candidate for the expansion?
No, unfortunately not. Yeah.
Okay.
So there are specific things that you have to look at because just like any procedure that's done medically, there's always risks, benefits versus rewards. And so you have to weigh that out.
Okay.
So for instance, some patients who have had a lot of invasive nasal surgeries in the past, they may not be good candidates. Patients with bleeding disorders and things like that, where bleeding is a risk, they may not be good candidates. Sometimes things like Ehlers-Danlos, where the elasticity of the skin and the palatal tissues is a little bit too stretchy. Sometimes that can be something that prohibits you from doing it. But I would say most patients are, but you will need to get a consultation in order to look at the imaging and see how your bones look, how big of a discrepancy there is, and what the likely success rate or result would be for you.
Okay, that's good to know. Now, what about kids? Like, is there a process to that too?
Sure. With kids, we typically don't need the expanders that are connected directly to the jaw with kids because they're growing. But there are a subset of kids who have very large skeletal discrepancies, a very, very small upper jaw compared to a very large lower jaw. And those kids used to require surgery as well. But there are times now where cases that used to require surgery, we can actually expand non-surgically in kids and move the bones more than we ever have been able to do in the past. And so when we do that, some kids will not have to have jaw surgery. They'll be able to do the expansion process and possibly a protraction process where we bring the jaw forward without having to undergo surgery at an older age.
Oh, okay. Now, would they use the same type of expanders, just different?
Yeah, so the fundamentals of the expander are the same. Essentially, the expander is just a device used to place force, and the force is going to be placed on whatever it's connected to. So in growing kids, it's connected to the teeth, and the teeth are connected to the bone, and so that's the expansion that we want to get, and it happens naturally, not naturally, but it happens easily when the kids are growing. Once the growth is done, those bones are rock solid together, and so they're not able to be separated non-surgically unless you place something that actually connects to the jaw directly. So those mini implants are actually placed in there and they're temporary. So while the expansion is happening, they're in there. And then once the expansion is done and the bone is healed, they come out. So it's a temporary anchorage that allows us to make that jaw wider.
That's like really incredible. Now, is there anything else that you would like to share with us?
Honestly, if anybody has questions, they can find us, like I say, they can find us online. They can reach out on LinkedIn. There's a lot of great resources out there as well. There's YouTube channels that are devoted to talking about this. Jaw Hacks is one of them. If you haven't heard that, you can check that out. I don't have any affiliation with them directly, but they do a good job of bringing education about this to the public in general. So certainly, do your homework, do your research, and if it's something that you're interested in, just seek out somebody in your area that provides those services. It could be life-changing for you. So, yeah.
That's awesome. Well, we're really happy to have you here. Hopefully we'll see you next year too.
Well, hopefully so. Yeah, planning on it.
Thank you so much for your time,
Awesome.
Doctor.
Thank
Have
you.
a blessed day.
Yeah, appreciate it.